All right, time now for another COVID-19 information segment with our investigative reporter, Brendan Kirby. And Brendan's here to talk about some of the latest medical research. Brendan, tell us about how a blood test could reveal just how much risk people face if they do contract COVID-19.
Well, Byron, you and I talked months ago about early research out of China about how people with certain blood types do better or worse with the disease. Well, now we've got some new research from George Washington University published in Future magazine. Researchers analyzed 299 patients with COVID-19 for the presence of 5 different biomarkers associated with bad outcomes. Of those 299 patients, 200 had all 5 biomarkers. These biomarkers could help doctors predict which patients are likeliest to suffer the most severe complications. That means it may be possible to tailor treatments based on a simple blood test, which could, at least theoretically, improve outcomes for people who have been infected.
That would be special. But speaking of ways to identify the virus, there's interesting research from Germany showing man's best friend could help.
Yeah, that's right, Byron. This is a great story for dog lovers. The study published last month in the journal BMC Infectious Disease suggests that dogs might be able to help fill the gap in the ability of testing to keep up with infections. Researchers trained 8 detection dogs for 1 week to detect the saliva or tracheobronchial secretions of patients with COVID-19. It was a randomized, double-blind, controlled study, and here are the results. Of 1,012 randomized samples, the dogs achieved an overall detection rate of 94%, with 157 correct indications of COVID-19 samples and 792 rejections of those that were negative. There were 33 positive samples that the dogs incorrectly identified as negative, and 30 samples in which the dogs got it wrong the other way around. This might not be as accurate as an approved lab-confirmed nasal swab PCR test, but Byron, it would be a big improvement over some of the methods that are being used to screen, like those temperature checks that many organizations use to check folks entering the building.
You're right, Brendan. Thanks very much. Brendan Kirby will be back with us for Fox 10 News at 9 with more on the coronavirus. And if you have a question, you can just email it to him directly at brendan.kirby@fox10tv.com.